各位观众，大家好。我突然发觉这个图像没有送出去，很抱歉，很抱歉。我自己对着屏幕白说了20分钟。今天是礼拜一，我再重新补一下。不过我把重要的数字我都记下来了。今天是礼拜一，5月31号。周一，那么照例呢是按照3天的顺序给大家播报了这个新增的阳性案例。那么好在呢，过去的10分钟，他们开始了15分钟左右呢，都是说了原住民，我们在这个学校旧址、小学旧址发掘了200多例的原住民的儿童的尸体。那么对我们的前辈，当然我们的我们不一定是华裔，也就是我们加拿大现在这些公民的前辈对原住民所犯的错误做了这个认识以及承认以及这个提醒。所以呢 Bonnie Henry 呢也提醒了很多。那么同时呢，我是把数字都记下来了。过去的3天呢的确是显著下降，周五到周六是258，周六到周日是238，周日到今天是212，3天是就700多例。所以这个也是绝对的好消息。让我看18、90、708例这个是绝对的好消息。那么住院呢是249个人住院，重症监护呢是78，也是好消息78。那么已经有325万的人次已经接种了新冠疫苗。那么我们继续对不起大家，我这个像个屏幕说了20分钟的空话屁话，不过已经没有什么重点我都记下来了。他们主要还是提到了这个212例这个学生原住民的尸体的问题。同时呢 Bonnie Henry 呢始终强调给大家，在4月15号之前接种的人请千万记住来注册，这个注册只有2分钟。系统呢，政府的系统已经有你们的第一针的疫苗的记录，包括你们接种的批号、时间。问题是他们没有你们的联系方式，所以这个注册对你们来讲就多了一个手机或者手机短信或者 email 的联系方式。这样的话呢，他们就会以短信或者是 email 发通知给你，而不用等邮件。那么同时呢，这个4月15号之前现在轮到打第2针的人呢，他们已经在用那个 Canada Post 有信函给你们发了这个是之前的这些重点。我们继续看下去。他现在还在说3,250,000，也就是325万的人接打了新冠疫苗。其中呢，第2针的施打其实从上周五开始已经在积极的进行下去了。那么同时呢，现在呢已经有66%这个呢是12岁以上。那么如果是18岁以上的话呢，更快，其实已经是很久了。
And that 3,185,217 registrations have gone through in British Columbia. I'd also note that after the announcement by Dr. Henry last week of the sending out of booking invitations for dose 2 to many people in BC, that just under 450,000 booking invitations were sent out. And as of today at 8 a.m., 381,077 bookings have been completed, either online or through our call centers. And we encourage people, of course, to respond when we ask them to book and to continue to register. And this is an important theme.
所以他也是说到了，请大家能够积极的去注册。上次呢，伯尼医生也提到了注册和预约是2回事。他说的确有点搞，请大家原谅。注册是注册，预约是预约。你注册了之后，系统呢就会录进去。同时呢，他们公卫系统呢，他们会派发这个决定第1针的时间 以及这个疫苗的安排带来高效率，所以呢，注册了之后呢，他们会以最快的速度通知你预约。我相信屏幕前的大多数网友应该已经施打了。他说这个18岁以上的能够施打的人已经70%了，所以呢，相信10个人里边，我们10个观众里边有7个观众其实已经打了疫苗了。那么同时呢，伯尼医生也说了，不是所有的疫苗都是100%保护的，所以呢，即使你施打了疫苗，也要注意，我们现在只是开放第一阶段的中期，还远没有到了放松的时候，所以大家该保护的，保持社交距离，戴口罩，勤洗手，咳嗽遮嘴巴，远离人群。当你不舒服的时候小规模人员聚集。这些都是逃不掉的。那么他也是卫生厅长也在强调了请大家千万遵守卫生规范遵守我们的卫生命令。卫生命令没有变，无非呢第一阶段呢现在就是宗教界的宗教活动允许室内有50个人，其他的一律室外也是10个人，室内说实话是没有的，也就是堂食可以6个人一桌这个是第一阶段第一阶段呢要到6月15号以后才开。
It is critically important that we all take advantage of those opportunities and continue to increase our level of immunization. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas aux 3 périodes de référence de 24 heures chacune. Pour la première période de référence, qui s'étend jusqu'au 29 mai, nous avons eu 258 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 30 mai, nous avons eu 238 nouveaux cas. Au cours des dernières 24 heures, 212 nouveaux cas se sont ajoutés.
带宽可能有点小问题，所以呢，大家看到的图像有点跳。可能是 Internet 这个不稳定，这个情况还是有。大家经常如果收看油管其他频道，包括我们频道的有些如果直播的话呢，经常会有时候会这种声音飘或者图像有点抖我觉得这个也是因为基于 Internet 带宽。那么如果这个
A reminder to reporters on the line, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. First question, Binder Sajan, CTV.
Hi, Dr. Henry. Manitoba today said that people there who received AstraZeneca can mix and match, and that the UK study has been delayed. So I'm just wondering, what considerations or studies are you looking at now in terms of AstraZeneca and what people should do for their second shot?
他说那个曼尼托巴省呢，今天是延迟了阿斯利康打第1针之后打第2针可以混合的这个计划，因为英国的现在研究证明呢，现在不认为混打是一个好的结果，所以我们 BC 省现在怎么办？
Manitoba has come out with, and I've said this several times, that we are waiting for some more of the data.
他说我也在始终强调，我们要等待更多的数据来支持研究结果，到底可以混打还是不可以混打那么这个主要是基于免疫学的概念。
I think it will be no surprise to people that there will be options. People will have a choice. And we just need to formulate the risk-benefit in a way that people can understand. And we're also looking at the logistics and operationally how will this work in our system. So we have time, and we have time. So by Thursday, we'll have it all laid out for people so that they can make their own choice.
Binder, do you have a
但是美国也会有一个问题，就是强制疫苗，强制疫苗和阿斯利康疫苗，有一个是线性血体病毒，一个是灭活的，所以也没人研究过，因为美国不需要去混打。因为美国主要是生产辉瑞和莫德纳。当然了，刚才伯尼医生也在给大家说了一个好消息，也就是莫德纳会经这个礼拜和接下来几个礼拜会大批量到货。
It may give you even better protection. So I don't think there's any concerns. If the studies at the end of the day show that there's less protection in getting an mRNA as a booster dose, then yes, that is an option, is to have a second mRNA dose at least 28 days or so afterwards. So those are all things that we're looking at internationally. But I don't believe there's going to be any concerns for WHO-approved vaccines in terms of restrictions on travel.
Next question, Marcella Bernardo, News 1130.
在打增强针的时候只打信使 mRNA 疫苗的话，那如果证明无效的话，那我们也不考虑。那么现在呢，一切的选项都是在考虑当中，因为都没有尚未结论。那么马尼托巴呢，只是暂停这个阿斯利康的人打第二针是打信使疫苗。
And to come back later or to book again. So would you be able to explain why that's happening?
那么这位记者问的是，有些人抱怨说我们这个已经打了第一针的，已经预约了第二针的情况，有些是没有被他们打上。
To be honest, I have heard that there has been concerns with the system, sending people messages that their appointment had been cancelled because they had not yet been at the 8 weeks from the initial dose. So that is an issue that we've seen, and it may have been that people had booked their appointment and then it was recognized that they had not yet been at 8 weeks for dose 2. I know there was some confusion this weekend, and this is a challenge with the system that is registering millions of people. There was some, especially on Saturday, we understand there was some concerns where there was a blank screen and it was part of the system being updated. So I know there was a lot of people who sent me messages and we forwarded them on to the team. I know the call center as well was had some issues, particularly on Saturday, with keeping up with volumes. So I am hopeful that those things have been reconciled. And there's always glitches when we have large numbers of people that we're trying to put into a system as quickly as possible. But I also know that operationally, at least the clinics that I've been involved in, and we had an update again this morning and over the weekend, that we were able to move vaccine around. So people who showed up at the clinics, there was not, that I'm aware of, that appointments were canceled because of lack of vaccine. That's not an issue that I'm aware of.
Marcella, do you have a follow-up?
Yes, thank you for clarifying that, because we just weren't sure if it meant that there were lots of children showing up to get vaccinated, and that might be a good thing, that we're actually seeing more people showing up to get appointments or to get vaccinated rather than what we're seeing in the United States with people not showing up. The other question I was hoping to ask you is regarding the outbreaks that we're seeing in care homes and possibly in acute care facilities. I know there's 6 right now at care homes, but I'm hearing from people who are worried about how long it's going to be before they can take their masks off and spend time with their loved ones. But you've kind of been expressing that you're nervous about whether or not we can lift these restrictions too quickly when we are still seeing the outbreaks and the virus still being very active in care homes.
Yeah, and this is something that we'll need to take very slowly, because even with a highly immunized population, which most residents are now in our care homes, we've seen some rapid transmission, particularly of some of the new variants, and that's a concern. They are much more transmissible, and we have not yet finished second doses for all residents in all care homes, but we are working on that. And of course, we want to make sure that visitors receive their second doses too. And I know essential visitors and workers, that's been going on. But we are not at a place yet where we can take off those restrictions in long-term care homes. There is still a very challenging environment where people are in close contact. So what we need to do is make sure that people are able to visit according to the new guidelines that we have, but we need to be patient with mask wearing for the next few months, and we're looking at least to July. and then we can see where we are in terms of transmission in our community. Right now, we're at that point where we still have quite a lot of transmission. We have a lot of people immunized, but we're not at that point where our immune systems are fully protecting us yet. So we need to continue with the second doses, and we're going to, as you see with the over 300,000 people booking appointments in the next 2 weeks, we're going to see a dramatic increase in the percentage of people with dose 2, which is important. Right now, that's a way to increase our community protection as well. But we also need to address that there are certain pockets of communities around the province where vaccination rates are still lagging behind, and that's where we need to encourage everybody to support their family and friends to get out and be protected. It not only protects you, but it's important for your community too.
可能性的传染一般都是要2周时间，所以现在才过去了1周，所以接下来如果下个礼拜的今天还是这些数字或者更低，那么这个情况就对了。
As more teenagers get vaccinated, could you
那么这位男记者问的也是10几岁的孩子，更多的越来越多的这个孩子们已经接种了。
to have more comprehensive graduation ceremonies?
You know, this is something obviously we've talked about with our school health team. So public health has been providing advice. That's the group that meets regularly with the superintendents and the parents and the student groups and the teachers. And there is guidance that's come out from the Ministry of Education that's based on what we've provided. So there are lots of really great, important, innovative ways we can celebrate graduation this year. Certainly outside within the restrictions that we have, but I leave it up to that group to provide the best advice about how to do this safely across the province.
Richard, do you have a follow-up?
I do. The province has made special exemptions for other groups. Religious ceremonies is one of them, and I know a lot of work got put into that. Would there be any thought to work with this group at the school level to potentially fast-track those Step 3 restrictions? If we're on track and they come into effect July 1st, with schools ending at the end of June, would you be willing to have conversations with those school communities about larger outdoor events potentially in that last week of June?
I know those conversations are ongoing, Richard, and yes, I don't know the day-to-day on that, but I know that those are things that are the conversations that are being had. Those groups meet weekly, so I know they've been talking about how to be able to do this safely, particularly outdoors in the next couple of weeks, yes.
Next question, Moira Whiten, the Tyee.
Hi, good afternoon. Thank you so much for taking my question and for your words and your expertise, Dr. Henry. My question is about last week you announced that clinically extremely vulnerable British Columbians would be prioritized for second doses. And as you know, the list was criticized as being rather narrow and excluding a number of people who are still compromised, and that same week you said they may still have to continue taking precautions even as the province opens up longer than folks who are not at extremely high risk. What do you say to those people who are excluded from priority second doses but are still considered high risk, and why not open up the eligibility for second doses to a wider group of people?
So there's nobody that's excluded. We all have to take precautions, and people who are immune compromised, even if they have second doses, they still need to continue to take those personal protection measures. And that's because we're not out of this pandemic yet. But we do have a very specific group that were identified. It was over 200,000 people, so it is very broad, and it was based on clinical judgments from a wide group of experts, including cancer care and renal care, under the auspices of the Provincial Health Services Authority. So that is the group who determines who were
治疗啊，等等等等，所以这个一定要请大家注意。所以一定要记住，我们还要考虑到有一些人英文叫这个 clinical vulnerable people， 也就是说他们是被医学上诊断为不能打疫苗的这些人，一定要考虑到他们的安全，所以不能说我打了第一针了，我可以到处走啊，或放松啊，或者是不戴口罩啊，不存在这个问题。你一定要考虑到保护那些不能打疫苗的人。
Will be able to get their second dose. People by age,
同时呢，一定要记住，我们只有打了第二针，才能够慢慢放松我们的限制。
So I just want to reassure everybody, the second doses will be coming much quicker than we had to draw things out over a period of many weeks.
那么同时呢，他也给大家再次确认我们的第二针的接种速度会很快不像第一针那样。同时大家看到了两针之间的时间从12周、16周，现在一下子缩短到8周，很有可能接下来还会缩短，因为我们越来越多的疫苗要到货，包括阿斯利康。那么同时呢，他也希望就是能够先注册的就注册，注册了之后呢，我们会通知预约的话，马上就可以给你打第二针。
Moira, did you have a follow-up?
所以第二针也很重要。博尼医生上个礼拜也说过了，这个第一针和第二针的区别。第一针主要是为社区设立防线，第二针才是为自己建立起更长、更有效的保护。
And just other I believe under other hindrances to effective caregiving and time together that I know you're using of restrictions in long-term care homes aim to avoid. When are we going to see perhaps more provincial intervention, ensuring that these guidelines are rolled out evenly across care facilities as the province reopens? Long-term care residents and their loved ones can have the same time together that others in the province are getting.
Yeah, I know how challenging and how difficult this is, and I know Minister Dix can speak to it as well. But right now, what we are seeing in some cases is inconsistencies in applying the guidelines that are in place. But I do not believe we're in a place where we can allow for increased numbers of people visiting. Right now, the minimum is an hour, but we're hearing stories that some facilities are restricting the amount of time that people can spend with their loved ones. And so we need to increase consistency, and I know my colleagues in the health authorities are working with the over 500 care homes to try and address that. It is right now a very difficult time, and yes, we want to and need to spend more time with our loved ones in long-term care, but we continue to need to take those precautions because not everybody has their second dose, and not every vaccine is 100% effective yet. So we need to take that time and be very careful because we have seen
因为没有一个疫苗是100%保护的、有效率的，所以这个都是，而且打了针之后也要10天1个礼拜、2个礼拜以后才能够那个保护起来。
Next, we go to our final question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Final question, we go to Tanya Fletcher, CBC.
今天他们很早，不知道为什么，今天结束的比较早。最后一个问题了，最后一个问题了。
Received the Moderna vaccine in error, and how concerned should teens who received Moderna instead of Pfizer as a first dose be? What should they expect for their second dose now?
Yeah, so it is unfortunate. I'm aware of about a dozen cases, and it is an error, but it is something that we don't believe is an error that will cause any clinical harm to people. The Moderna vaccine has done a trial down to age 12,
那么这位记者问的主要还是莫德纳对12岁到17岁儿童之间的施打的问题因为现在美国的数据已经出来了。那么他说主要还是联邦的药检管理局，我们加拿大本自己的 FDA 批准的话。
that does not excuse the fact that it should not have happened, and that the immunizers certainly need to disclose, which I understand they did to the parents and to the young people who received the vaccine in error. And we have put in more processes in our clinics to try and make sure we're not mixing vaccines. And you can tell that it's challenging, and one of the reasons why we're very careful about where people will receive AstraZeneca as your second dose, for example. So I don't believe it's an error that's going to cause clinical harm to people, and we expect that Moderna will be approved for use down to that age very soon. And in that case, people who received Moderna will receive the Moderna as their second dose as well. I think the other thing that's reassuring to us is the National Advisory Committee on Immunization has looked at the interchangeability of the two mRNA vaccines, and supports that there's no safety concerns or effectiveness concerns if you have Moderna and then Pfizer or vice versa. So as much as we can, we will try to make sure everybody gets the same product for their second dose, and we'll make sure that everybody gets the on-label application for each product, which means right now Pfizer is the only product that's approved for use down to age 12.
各位观众，当然了，我不是科学家。但是我相信能打同一个品牌就打同一个品牌，所以请大家能够注册就注册，预约之后就预约，预约了之后他们会给你莫德纳就莫德纳，因为上个礼拜他说过，只要你是打莫德纳第一针的，有可能第二针小部分人有这个极小的可能打辉瑞，因为莫德纳跟不上。但是今天他也说到了，莫德纳也会大量到货，虽然没有辉瑞那么多。
Here for people with first or second doses, depending on if we open up further?
Yeah, so we have to be careful about looking at that. So that was a small number of people that they looked at a specific strain and whether there was breakthrough in people who had a single dose versus a second dose, particularly looking at the B1617.2, which is actually there's a new nomenclature coming out from the WHO that should be make it easier for us to remember all of these variants of concern, but I haven't had a chance to look at it in detail yet. Having said that, this was a small study to look at whether there was more vaccine breakthrough with this new Indian variant, and what they did find was that the vaccine is very effective against it,
那么这个他再强调了一遍，对印度变异体的现在的这些有效的疫苗对他们的保护还是有效的，不是说我们的疫苗对这个印度变异体没有效率，还是有效保护的。
The measures that they're taking, along with immunization to prevent transmission,
所以他说英国的这些做法还是可以借鉴的，除了疫苗以外，还加强管制。
So we are looking at those same things here. That's why our opening is not based solely on immunization. It's based on looking at whether the measures that we have in place are continuing to work to prevent transmission. And it's
因为
going
我
back
们
to
现
where
在
we
所有
were
的
with
这
the
些预
basic
防
public
措
health
施
work that
是
my colleagues
能够
have been
有
doing
效的
for
阻止病毒的
15
传
months
播。
now, which is case
我们不
management
希
for
望
every
大家
single
再回
case,
到过去那
making
种
sure
封
we
城
find
啊、
the
封店
contacts,
啊这种
making
情
sure we're
况。
isolating people,
已
making
经
sure
15个
anybody
月
who's
了，
feeling
大家
unwell
也
gets
开始
tested
受够了。
and gets
那么
reported
我
to
们
public health
现
so
在
we
呢
can
也
support you in
看到了
preventing
越来越多的
transmission.
人
And this is
从
about
隔离
the
当中走
outbreaks
出
we're
来，有些
detecting.
呢
It's
是
about
这
looking
个
at
去
workplaces.
检
It's
测。
about all of the public health things that we're doing to test, trace, and track people to keep the virus under control, and that will
所以
continue
我
to be
们所
really
有的这些
important
措施
as
点
we
点滴滴加起
increase
来
the，numbers
才
of
建
people
立起一个
immunized
防范
with
的
both the
一个
first
体
dose
系，
and the
来
second
保
dose.
证这
And
个
of
病
course, it
毒
is a key
能够受到
consideration
控制
and why we have
不要
shortened
再那
that
个
interval
传播。
for second doses. Now that
所
we
以对
have
大
the
家来
supply to
讲，
do
第二
that,
针也是
we
很重
want
要
to be
的，
able
请
to
大家
get
一定要考虑。
as best protection we
这
can
个对
and as
每个
many
人来
people
讲
we
最
can
好
as
的
quickly
保
as
护就是打
possible.
第二针。
And so it is very much taking in all of those moving factors as we're watching the strains that are causing disease here in the province. And I will say, as we've moved now and increased our capacity to do whole genome sequencing, we will be doing whole genome sequencing of every positive case to help us
那
understand
么同时
exactly
呢，
which
现在
strains
呢，因为基因
are
测序的
transmitting, and this is
工
going to
作
be more
量，
and
他
more
们的容
important
量已经
as
加
our
大了，
numbers
所以呢，
continue
现
to
在
go
每
down,
一例的
and
病例
as
阳性
people
案
start
例
to be
都
more
去做
mobile
基
and
因
travel
检测
more
了
so that we can
不是原来
detect
说
if a new
10%
strain
的样
that has
本
any
或者50%
characteristics
的样
like
本，
being
现
more
在所有的基
transmissible
因
or
检测、
seeming
基
to
因所有的
evade
样本都去
vaccine
做基因
get
检测，
introduced
因为
into the
检测
province.
的容量
And
扩
this
大
is
了。
something we're working on across the country. It's going to be really important as we're moving into these next phases to be
因
able
为
to
接下来
monitor
我
every
们
strain
要
that's
开
causing
放的
infection
第2段、第
in
3
the
阶段、
province.
第
And
4
so
阶
that's
段
something
都是要
we're
根据
moving to
我
as
们
well
的
over
这
the
个
next
检
little
测
while.
以及疫情的实际情况，才能够逐渐的展开。 那么卫生厅长呢，照例也是最后一个问题，把 Bonnie Henry 刚才给大家提到的，做一个法语的介绍。那么问他们的这个情况呢就会结束。同时呢，我会把刚才我对着屏幕讲了差不多快20分钟才意识到。 这个大家根本没看到，所以呢，我会把这个再给大家复述一下啊。那么现在因为他是说的这个已经是伯尼医生的重复的话，所以我就把这个画面给暂时给关了。 好，各位观众，我会把数字重要的数字我再给大家说一下。周五到周六是258，周六到周日是238，周日到周一是212，所以3天。 这个数字是708。那么现在 BC 省的总数呢，就到了144289，其中沿岸卫生局是140个，飞沙卫生局是394，岛上卫生局是18，内陆卫生局是113。 北部卫生局新增是42，住院总数是249，大家可以看到显著下降。重症监护又是显著下降，现在到78个。那么过去3天很遗憾，死亡新增11例 ，BC 省的总数现在到了1703。 其中呢，有1个是40岁以上，其他的都是60岁以上。 那么到目前为止，已经有325万的人接种了，占了18岁以上的人70%以上。如果把12岁以上的儿童算进去，已经占了66%。所以这些都是好消息。同时，伯尼医生一再呼吁，第一，4月15号之前。 接种的疫苗的观众们，请你们抓紧时间注册，这个注册就2分钟。注册完了之后，政府就会发短信或者是发邮件通知你们预约。这样的话会大大加快双方的速度。同时呢，第2个信息就是打了第1针，千万别疏忽。我们还是以没有打疫苗之前的态度来对待自己、对待社会、对待别人。这样的话就能够保护起还有很多没有打疫苗的人。同时，请大家务必认真对待第2针，第2针才是最重要的。所以今天的5月份最后一天 ，BC 省的新冠也就到这儿给。